Hi everyone! Today we're going to be talking about some anxiety disorders and phobias. Please remember that you're not a mental health professional and neither am I, so please try not to diagnose yourself, your friends, or family members. So, what is anxiety? Anxiety is a combination of symptoms that include physiological features, behavioral features, and cognitive features. Physiological just means things that happen within your body. Behavioral refers to the way you react, things that you do either subconsciously or things that you're actually well aware of. And cognitive features just refers to the way that you think. Anxiety can be helpful, harmful, and become a disorder. It can motivate someone to prepare more for something that they might be really nervous about. It can help someone be more attentive or vigilant. This is important because anxiety runs off of fear. Thus, when we are in a fearful situation, our anxiety sometimes helps us protect ourselves. And sometimes it can even make us communicate better. But of course, too much anxiety can result in an overwhelming sensation of fear and can cause avoidance behaviors in certain situations, which is then considered a disorder. One of the anxiety disorders is generalized anxiety disorder, or GAD. According to the DSM, it is characterized by pervasive or excessive anxiety lasting at least 6 months. The worry tends to be about multiple things at a time, and it's really difficult to control. Some symptoms also include restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. The lifetime prevalence rate for generalized anxiety is around 6%. The onset is usually around mid-teens to mid-20s, and the ratio is 2 women for every 1 man diagnosed with GAD, and the course is typically chronic. Factors that influence the development of GAD include a genetic predisposition, hypervigilance to possible threats, cognitions, thoughts, or learned beliefs, intolerance to uncertainty, and intensive cognitive processing. Some more factors include classical or operant conditioning. Some of the treatments include imaginal exposure, acceptance of anxiety, mindfulness, cognitive therapy, emphasis on action, problem-solving skills, relaxation exercises, and antidepressants, specifically SSRIs. Specific phobia refers to the fear of known objects or stimulations, and when the stimulus is introduced, it results in immediate anxiety or fear. This reaction is usually excessive and unreasonable, and the stimulus is often avoided or endured but with complete dread. Some examples of phobias are blood, injury or injection, animals/insects, natural environments, or certain situations. And there, of course, are many others. The prevalence rate is usually about 12.5% of the population. More women than men are diagnosed with phobias, and it often is also a chronic course. The age of onset varies kind of depending on the phobia. So you can see in this chart that animal phobia, the age of onset is around 7, but agoraphobia tends to happen a lot later, around the age of 28. Treatments include exposure therapy, which can be done through guided imagery scenarios, in vivo, or virtual reality. Cognitive therapy includes identifying and correcting dysfunctional or disoriented beliefs. This is also known as cognitive reconstructing. Social anxiety disorder, or social phobia, is the fear of embarrassment and negative evaluation. A common misconception is that it is the fear of people or socializing, but this is not true. People with social phobia tend to fear that their performance or non-performance isn't good enough and that people will talk bad about them or they'll get embarrassed. The feared social situation is often avoided or endured with intense fear or anxiety. Factors that influence the development of phobias, more specifically social anxiety disorder, include genetics, observing others with SAD, early traumatic events, parenting style, isolated upbringing, certain brain structures, societal expectations, cognitions, and classical operant or prepared conditioning. The prevalence rate usually goes from about 5% to 12% of the population, and the onset often happens within young childhood or adolescence. Agoraphobia is the fear of being in places or situations that cannot easily be escaped or where one cannot get help if panic-like symptoms were to occur. This often leads to avoidance behaviors. The definition is a disorder that's characterized by an intense fear of leaving the house, including open, enclosed, or public spaces. Not all agoraphobes are housebound. Many have safe zones, which are places that they're comfortable going to, or a person that they feel safe leaving the house with, someone who can help them if panic-like symptoms were to occur. The onset is usually between the ages of 13 to 35 years old. It can occur with or without panic attacks or a panic disorder. Public transportation, shops, theaters, restaurants, standing in lines or crowds, in public alone, or anything like that can cause irrational fear of something bad happening. People with agoraphobia are often also diagnosed with depression, social anxiety, PTSD, OCD, or generalized anxiety. Before going any further, I'd like to define what a panic attack is according to the DSM-5. It is an abrupt surge of intense fear, discomfort, and/or sense of imminent danger or impending doom that reaches a peak within minutes and during which time 4 or more of the following symptoms occur. But before we get into symptoms, it is important to mention that there are 2 types of panic attacks: expected and unexpected. As you can tell, expected is something that we know was triggered by a specific event or person. But unexpected sometimes just happens. These symptoms include hyperventilation, heart palpitations, nausea, chills or hot flashes, sweating, trembling or shaking, numbness and tingling, dizziness, feelings of choking, chest pains or discomfort, derealization, and the fear of losing control or going crazy. Panic disorder, according to the DSM-5. This involves repeated, unexpected panic attacks. It has to have at least 1 month of persistent fear of subsequent attacks, which causes significant changes in behavior. This kind of brings us to the panic cycle. So how does panic attacks turn into a disorder? Well, panic attacks stem from anxiety. So anxiety causes a panic attack. which causes fear of having another one. This fear causes more anxiety, which thus causes another panic attack, which causes more fear, and the cycle kind of just keeps going. Factors that influence the development include biological factors, genetic factors, classical conditioning, cognitions, anxiety sensitivity, and interoceptive avoidance. The lifetime prevalence rate is about 5%. It's an acute onset in early adulthood, and it's more common in females than males. So as we can see in our chart, in the past year, a little over 1% of males were diagnosed with a panic disorder. However, in their lifetime, a little bit more than 3%. While in females, in the past year, a little under 3% was diagnosed, and in their lifetime, about 6.5% of the population was diagnosed. Treatments for panic disorder and agoraphobia include psychoeducation, exposure therapy, interoceptive exposure, cognitive therapy, relaxation exercises, antidepressants, benzodiazepines, which are not highly recommended, and involving the family. Thank you so much for tuning in, and I hope to see you guys next week.